Welcome. I'm Dr. Eric Potter from Sanctuary Functional Medicine that's here in Spring Hill. We are a functional medicine practice that takes care of kids and adults. Functional medicine is about getting at the root cause, treating a whole person, and also across the lifespan. Today we're going to be talking about developmental nutrition. But first, a little disclaimer. So most of the time when you have a doctor, they're going to do a talk, they're going to have a little disclaimer. This is not medical advice. Talk to your doctor before you go home and do this. This is not telling you this is what you should do for your child. But another disclaimer. This is about knowledge and wisdom that I want to give you. Something that enables you to care for your children, care for your family a little bit better, but it doesn't give you control. This doesn't guarantee your children are going to grow up to have straight A's, get into Ivy League college, or anything else. But those things are ultimately under God's control. This is not about making you feel guilty that you didn't do something, or that you can't do something, or you're having trouble with something. This is about knowledge and wisdom, a little bit more help in knowing how to raise your kids with good nutrition. So, with that, the principle is we want to teach kids how to have good nutrition so that way as they grow up through a lifetime, when they're our age, they've had 20, 30, 40, 50 years of good nutrition, good habits that they're going to carry through and they're going to pass on to their children. So we want to see that continue, not just, oh, well, they're healthy, but then your grandkids end up not being healthy. We want that to continue. So it's putting in a lifestyle, not a diet. What's a diet? Beginning and end. You look forward to this part, you hate this part. A lifestyle is something you say, oh, I can do this. I can do this. My children can do this for the rest of their lives. So, 3 things before, during, and after. That's the timeline we're going to look at. And in each of those areas of before birth, when mom's not even pregnant yet, during the pregnancy, and then after the child is born, throughout their lifespan, while they're in your house, what can you do? We're going to look at removing bad things, avoiding things that are bad, and adding good things into their lifestyle, their nutrition, so that they grow up more healthy. So with that, it's no surprise that a mother's health affects their children. We know about smoking, we know about alcohol, certain medicines if you take it while you're pregnant can have adverse effects on your children. We know about that, but it's more than just avoiding the bad stuff. Just like I've already said, we want to add good things into the diet so that way they have habits that they're going to keep doing for the rest of their life. So, let's start with the obvious place, before mom is even pregnant, maybe before mom's even thinking about it, is saying, what can moms do, future moms to be, do to prepare for when they are pregnant? Because as we go through this, you're going to see there are some things that you shouldn't do about being healthy while you're pregnant. So, first of all, starting with avoiding the bad things. So toxins. Anybody know some toxins that when you're pregnant you're not supposed to eat? You're supposed to avoid certain fish. So avoiding those things, well, why should we eat those beforehand, get that mercury in the mom's body only a few years later to be having a baby and thinking, oh, well, that mercury's still there. So don't put it in the first place. So there's going to be some sources out there where you can find different fish. Some are good, some are bad. Trying to find ones that are going to be low mercury. The predators, the shark, some of the tuna, some things like that are going to be ones that have higher mercury. So looking at pesticides. So who worries about pesticides for their children? So it is a contentious, to say the least, issue. And you've got a lot of people on both sides, some screaming, oh, all organic, and others saying, oh, organic is poo-poo, don't worry about it. It's really somewhere in the middle, because we know there's studies that have shown when kids are eating non-organic fruits and vegetables, they tested their urine, they tested their blood, they look at what's in there, they put them on a 5-day organic-only diet, and those levels dropped. So we know that eating non-organic fruits and vegetables puts toxins into us and our children. So as much as possible, balancing that out. Because one of the things, the ones that say, oh, it's not a problem, often say, oh, the levels are so small, they're below the EPA's level. How do we really know if that's a good level? There's a lot of those levels change up and down, what's safe and what's not. And also those studies look at just that one chemical, but what if you have a little of this, 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 and little of this? All those can be adding up to actually having real effects on future moms-to-be or their children. So looking at those things, trying to do as healthy as possible. If you haven't heard of the Environmental Working Group, they're online, they're a group that have tested. You hear the Dirty Dozen, you know, apples and strawberries kind of go back and forth. Who is the most pesticide-laden fruits? Yes, you can wash some of those off. So if you're eating a non-organic apple, washing them correctly, washing them well, can remove some of that. Don't use bleach, because then the bleach actually gets into the fruit, but you can use safe organic soaps to get some of that residue off. Still, those on the Dirty Dozen, you think, maybe I want to eat those organic otherwise. But once again, we're talking about moms. Don't put those pesticides, don't put the mercury into the bodies even before they're thinking about getting pregnant. A lot of moms will say, oh, I'm going to smoke up until I get pregnant, then I'll stop. Well, number one, if anybody has smoked, they know it's not that easy just to drop it all of a sudden. Number two, you still put all those toxins in your body over a number of years. So cutting out smoking. Then inflammatory foods. So smoking stirs up inflammation. A lot of the foods we can eat, processed foods that have a lot of artificial dyes, artificial colorings, artificial preservatives, can also stir up inflammation in a mom's body, such that it actually increases, can interfere with fertility, it can interfere with the pregnancy itself, increase the chance of high blood pressure during the pregnancy. So preventing those things, so instead of trying to make dietary changes when you get pregnant, you say, oh, you just keep doing what you're already doing to begin with. And you'll hear a lot of things. I talked about mercury in fish. Who has some mercury in their teeth? So, do I have everyone that comes into my office that I look in their mouth and see silver fillings, do I have them remove those? No. But I look, if they have health issues, or we do testing, and yeah, I think this is causing part of this, I sometimes do recommend that. But where I recommend for moms, if a woman's 20s, 30s, and thinking about pregnancy, or just getting married and thinking, oh, you know, that's coming soon, I'd say, you know, if you do get a cavity, I probably would prefer you not to put another mercury filling in there, which there are some dentists, amazingly enough, that still do that. I don't quite understand that, but they do. So take the enamel filling and try to avoid adding something in there. And one of the things I mentioned, the processed foods, I like to say is that grace may cover a multitude of sins, but vitamins do not cover a multitude of McDonald's. So they've done studies where giving antioxidants to people going into McDonald's did lower inflammation, but not as much as if they never went there in the first place. So we all know, if you're like our family, sometimes you do the best you can. So this is not like, oh, you know, it's the end of the world, your child's going to, you know, fail kindergarten because you go to McDonald's once. That's not what I'm saying. I'm saying as best we can over a lifetime, we make as many wise choices, minimize those things that might affect our health or mom's health before and their health during. Now, some of the removing things. So we've talked about avoiding putting things in there. Some of the things you might look at removing. I already talked about. If you have mercury in your body, you have some symptoms and you go into a doctor and say, yeah, your mercury level's elevated. Before you got pregnant, you might want to try to get some of that mercury out. Because when the baby is inside mom, that mercury can get in baby when they're developing and cause birth defects and cause problems. So, if you found out before you got pregnant, yes, got it, you might want to look at doing some detox, chelation therapy, something to pull at least part of that mercury out. Or like I said, take some of the mercury fillings out before you go into pregnancy, because once you're pregnant, the last thing you want to do is start trying to pull mercury out, because the baby's going to get hit in the drive-by as the mercury's on its way out. So, toxins, does anybody know where most toxins in our bodies are stored? in that adipose tissue, our fat tissue. So we have that stored in there. If a mom has that stored, when she gets pregnant, some of those things are going to start coming out. So if you're getting rid of those toxins beforehand, you don't have to worry about it during the pregnancy, because you don't want to try to get it out during the pregnancy, as I already mentioned. Some of those things can be the toxic metals, whether it's the mercury, whether it's lead. I've had patients that did refinished old furniture, so they're sanding old furniture that has lead paint in it, or they've remodeled an old house, they've lived in a house that's 100 years old. You might want to look at getting some of those metals out of your body before you got pregnant. There's things you can do like sweat detox, you can do some of the juice detox. Once again, all these are things you should talk to your doctor about, and say, all right, is this a good idea? How should I do this? Don't just go off and do things without making sure that somebody's walking through that with you. And at the very least, consider possible exposures. Even if you don't do any testing, talk to your doctor. Yeah, I did some paint remodeling for a couple years as a job in college, or I did this. Just think through that, get a good history, see if there's anything you need to think about before you are thinking about getting pregnant. Removing inflammation. So if there are things in your body, removing some of the inflammatory sources, that may be looking at getting those processed foods out, getting those toxins out. I've had a patient who worked in industry where she handled a lot of chemicals. So it's one of the things we work with her about is helping her either sweat it out, do nutrition that will help her body detox itself, and also removing some of the bad fats. So if we did omega-3 to omega-6 ratios, and including omega-9s, we might see that our omega-3s are kind of low and omega-6s are high. So you want to kind of balance that out by diluting the omega-6s. And like the omega-3 for kids back there, they're obviously for adult products as well that you can get out there. Trying to increase that ratio so when your baby is inside you at the very beginning, they start out getting the good fats. Then want to look at some of the things you might want to look at adding into your diet. So making sure you're getting plenty of EPA, the fish oils, EPA, DHA. If you look at a fish oil supplement and you see 1,000 on the front, is that enough to know that that's a good product? What else do you have to look on the back? If you turn it around, you look at EPA and DHA. Because you could have 1,000 in the front, and I've seen ones where there'd be like 200 of EPA and 100 of DHA, but it says 1,000, but really you're only getting 300. So then when you're thinking, oh, I'm supposed to get that, then I need to take 3 times as much of that, versus a product where it says, oh, 1,000, you turn around and it's got 600 plus 300, you're like, oh, it's 900. That's actually much closer. So adding those good fats in there, adding olive oil, avocado oils, some of those omega-9s that also are anti-inflammatory, coconut oil, that's also very good. It is not a omega-3, so don't want anybody to get confused that. It's a medium chain type of triglyceride, so that way you're able to absorb it better. It also has some benefits as far as anti-yeast, help balance your gut bacteria, and I've thought about writing a book. Somebody needs to write a book that says 101 uses of coconut oil, just like duct tape, and see which one you can find the most uses for, because that really is coconut oil. You know, you take a spoon out, you put in your coffee, and then your baby needs a diaper change, you take a spoon out and you put it on their butt because they've got a little yeast infection. So I always make sure you switch the spoon, use different spoons between those two. So some other things you can add in. Vitamin D. Mom wants to make sure she has sufficient vitamin D stored in her body, because it's fat. Because if you think, oh, I got pregnant, now I can take vitamin D. Well, you're already down here, you're trying to tank up, and you're already starting behind, so you want to get that in there beforehand. Iron. Obviously, babies use a lot of iron from mom. Moms can get, anemic going through pregnancy because they didn't start off with enough iron. So if you do that beforehand, you're going to have less of trouble when you actually get pregnant. Antioxidants. So eating rainbow colors of fruits and vegetables. So I thought it was pretty hokey the first time I heard somebody say, oh, just eat rainbow color. I'm like, oh, that's silly. Actually, scientifically, when you look at the different colors in fruits and vegetables, the different colors are different antioxidants. So if you're eating a balanced mix of those, you're actually getting a lot of different, you don't want just a lot of one, you want a mix of different ones. So also making sure you're getting plenty of B vitamins. If there are any vegetarians watching on Facebook or here, you got to make sure that you get enough B12 and other B vitamins when you go into that. And that's one of I'm a meat eater, but I have a lot of patients that are vegetarians. That's one of the things we just make sure that they're getting enough of the B vitamin sources in there. The other thing to add in is exercise. Exercise helps during the pregnancy, but it's really, really hard, and almost overdoing it, starting an exercise program during pregnancy can actually be harmful. But if you've already started that, then it's going to be easier to maintain that while you are pregnant. So we've mainly focused on getting those things started. So you're going to hear some of those same things over and over again. In fact, some of the things I'll say, keep doing what we've already talked about adding in. So that's probably most of the things that are out there I've already talked about. But we're going to go through now during pregnancy kind of things to make sure. So again, the avoid, remove, and add. So one of the reasons to start out with a relatively healthy weight going into pregnancy is you don't want to go on a diet. You know, we don't like diets to beginning and end. Losing weight during pregnancy means you may not be getting enough nutrition for the baby that's inside you. So you want to make sure that you're able to keep a weight going up. Based on what you start, you may start at the weight gain you would want to aim for, maybe a little less or a little bit more based on your starting weight. That's something you want to talk to your OB-GYN about. I don't take care of pregnant women other than giving some nutritional advice in the office. And definitely don't catch babies when they come out. I say I'll take the handoff once the OB catches them. I don't mind taking them on from there, but I don't want to be the one catching them when they first come out. But you want to make sure your weight, talk to your OB-GYN, what's appropriate weight gain during that time. You want to avoid excessive weight gain because that means you're actually increasing inflammation in your body by the fat tissue, which produces inflammation. Once again, avoiding smoking, avoiding alcohol during pregnancy, making sure if you do have to take any medicines, even over the counter, talk to your physician to say, is this a safe thing that I should take during the pregnancy, or could this have potential harm for my baby? Again, avoiding mercury in fish. Don't be eating fish that has a lot of mercury in it during your pregnancy. Avoiding pesticides. Again, the organic fruits, you know, that might be a time that you lean a little bit more toward, yeah, let's do as much organic as we can. I do realize that organic fruit is quite a bit more expensive. You go in there and like, that much for that one little pack of blueberries? How many blueberries? That would be like, I could eat those, just turn the whole thing up, and you're paying several dollars for them. So that's when you use wisdom, doing the best you can with those things, pick out those things, or find a natural local source. A lot of farmers who are trying to do organic, they may not be certified organic, but if you know them and you know they're not using pesticides, that's another good option. What should you remove? One thing you don't want to do is try to really go through a detox during your pregnancy. And I talked a little about this earlier, but I'm going to explain in more detail. So if you've got toxins, mercury, organic toxins, different things in your body, and it's stored in the fat tissue, and you're trying to pull those out, it's got to go through the bloodstream. It's either going to go out through the kidneys, or it's going to get secreted by the liver into your gut, and you poop it out. What happens as it's going from all these storage sites on its way out? That blood is going through, passing through the placenta, the baby's getting exposed to that. So you really shouldn't try to do, doing the juice detox, doing chelation, or doing anything where you're intentionally trying to take things that are already in you and get them out. Either do that before or wait till after breastfeeding. If you breastfeed and you're doing detox as well, I really try to avoid, just because if moms are the same thing, that those toxins are come out in the breast milk and the baby can get those. So before or after breastfeeding is done, you do your detox. During those times, better not. You don't put any toxins in, but just don't try to be actively taking them out. Now, what should you add? So DHA, one of the good fish oils that you want to make sure is in there, is even a little more important during the pregnancy, because that has been shown. You'll see that in a lot of the formulas, the artificial formulas will add DHA, because that actually is shown to promote brain growth for children, for babies during mom's pregnancy. And you want to make sure during the infancy stages, they get enough too. So if mom is taking enough in, the baby's going to get enough inside or through the breast milk. When you think about vitamin D, obviously depending on what time of year, how much you're outside, but even if you're outside a good bit and it's the summer, although being outside 90-some degree weather right now with the humidity about 1,000%, it's hard to do that right now. But even if you are out a good bit, a lot of people will not do as well converting their vitamin D to actually active form. So you may still need to take a small amount of vitamin D during your pregnancy to make sure that you're getting enough. You want to, during the pregnancy, getting enough calcium. Besides the vitamin D, which helps you absorb calcium, getting about 1,000 milligrams per day, which is really 3 good servings of calcium-rich food, enables the baby, who's growing all these bones inside, to grow those bones without having to steal it from mom's bones. Because that's one of the things, if mom's calcium deficient during the pregnancy, she's going to lose calcium from her bones, and increase the chance of the osteoporosis, osteopenia, thinning of the bones later on. Iron. As we talked about earlier, getting it in your body so you've got good stores, but then during the pregnancy, around 27 milligrams a day of iron, which, usually, unless you're eating, a paleo diet, eating meat 3 or 4 meals a day, you probably need to take a prenatal that's got some amount of iron in it. You want to make sure, again, you continue your antioxidants, rainbow fruits and vegetables, you're getting all those different things, the baby's benefit. Continue exercise. But if you hadn't started exercise before that, is doing some mild exercise. You're not going to try to, although occasionally I hear women who are like, yeah, I'm going to run a half or a full marathon during a pregnancy, which I've run a half and that was hard enough, and I was not pregnant at the time, and I made it to the finish line, but really I'd advise against trying to overdo exercise during the pregnancy. There'll be time afterwards, but during the pregnancy, keep what you're doing, keep in shape. If you haven't started, you start a little bit, but don't go too crazy with that. And again, adequate B vitamins. And we're going to take a moment to talk about a specific one called methyl folate that I work a lot with in my clinic, because it's one of the specialty things I do is work with a gene called MTHFR. MTHFR depends on who you talk to and which ethnic group you're looking at. It could be any 20 to 40% of the population, so for women, in a population could have this gene, either 1 or 2 copies. What this gene does is slow down your ability to take folic acid from your diet, either from a synthetic vitamin or even from folates in your diet from green leafy vegetables, and turning it into methyl folate, which is necessary in your methylation cycle. Your methylation cycle is important because it helps with creatine, which is for muscle strength. It helps with turning genes on and off, controls which genes are turned on and off in your body. And then just a few hundred different other reactions that you need sufficient methyl folate and vitamin B12, which also participates in the methylation cycle. Now, if you know your MTHFR status, and oh, I had the gene, you definitely want to take methyl folate. Because you're not going to take folic acid from a vitamin or from fortified source and turn it into methyl folate sufficiently for you to give your baby enough methyl folate. Because what happens if a baby does not have enough folic acid? Increases neural tube defects, increases miscarriages, a lot of neural tube defects like spina bifida, where the spinal cord doesn't close or they have problems with that. So, if you know you have that gene, you definitely want to take methyl folate. However, not everybody has genetic testing for that. You think, well, how should I do it anyway? I would say yes. It's just a little more expensive to take methyl folate. You're going to make sure you're getting sufficient. You're going to get the right stuff. It's the active form of the vitamin. That way, there's no question. And that way, if 10 years down the road, you end up getting the test, and oh, I had MTHFR. I wish I'd known that 2-3 pregnancies ago. You don't have to worry about it. It's not going to hurt you to take it in the right amounts. I don't recommend going out and taking some of the huge high doses that sometimes you'll hear about. 500 to 1,000 micrograms. It's probably even somebody with MTHFR, 1,000 micrograms a day during the pregnancy is usually enough. Occasionally there'll be a few more, so don't go out and take 5,000. It's not really necessary. So that's going to lead me into the after. So we've talked about before, we've talked about during pregnancy. Maybe several of you are already in this position. There's at least one back there that's after, a little one back there in the back, is what do you do to help your children now after they're out? You can't control things inside, but what happens when they're out? Well, avoid doing the best you can breastfeeding. And I don't want to put guilt on anybody that's here or anybody that's watching. There's going to be medical conditions when breastfeeding is not possible. There's going to be medical conditions both for mom and the child that sometimes interfere with that. Sometimes it happens right away. Sometimes you can get breastfeeding in for a few months and then have to stop. You know, I have several patients that are in that where we've talked about, okay, for mom's medical condition, how long do we continue breastfeeding until we stop so mom can start taking care of herself? This is not about guilt. This is just doing the most you can. And studies show the longer you do it, the more benefit. But even 1, 3 months, 6 months gives benefit of breastfeeding for the baby. So, avoiding the bottles as much as possible. And also, the other thing about bottles, if you can get your hands on glass bottles instead of plastic. So even though they're making, a BPA-free plastic bottle is better than the BPA-laden plastic bottle, but even better is if you can get the glass bottles. You do make those, they cost a little bit more, but that is one thing. BPA or other plastics are getting into your child, and if they're feeding 5, 10 times a day, and they're getting those plastics in them, they can have xenoestrogen effects, other effects on their growth that we're only beginning to probably see a lot of the side effects in the last, probably this generation. We're starting to see a lot of those effects on children. Making sure you're not stopping any of the good things we've already talked about. Keep the good stuff going. Now, the other thing is, for the baby, if mom is breastfeeding, and mom's taking DHA, the fish oils, and mom's taking methyl folate, the baby's going to probably be getting those. However, if mom has to start going over to bottle feeding, you want to make sure the baby is getting methyl folate, especially if mom knows that she has MTHFR, because there's a good chance, if mom has 2 copies, we know the baby at least gets one of those. If mom only has 1 copy of MTHFR, the baby's got a 50-50 chance of having a copy. So, don't take a chance, making sure the baby is either mom continues the methyl folate, mom continues DHA for the brain growth of the baby breastfeeds, gets that, the baby's bottle feeding, making sure they're getting that from other sources. There's a lot of good sources where you put a few drops of DHA liquid, baby can just suck it and swallow it down, and also liquid methyl folate, just a few drops, and the baby's getting the methyl folate they need. Now, there's some things you should avoid. Raw honey, raw juices for a child under 1 has a risk of botulism. Botulism is basically where a bacteria makes a toxin, gets into the baby, damages their nervous system, and can paralyze them. It can be life-threatening. And what happens is those things can grow in some of those raw honey and raw juices. Now as they get older and their stomachs produce more acid, they can eat those things without a problem. That's why we can eat raw honey without it being an issue. But for babies under a year, it's better to be on the safe side. It's not a guarantee they're going to get it if they get it, somebody gives them a spoonful of raw honey. But if you have control of it, trying to avoid that is better. What things should you remove? Well, if you've removed all those things before, and mom's breastfeeding, and she's not eating processed foods, she's removed any mercury-laden fish, you're not having a lot to do except, once again, keep doing what's already become habit and a lifestyle. Again, what things should you add? We're getting back to the add part. Vitamin D, if breastfed only, making sure the baby's getting some vitamin D because it may not get as much from mom's milk, and that can just be some drops that can be added to the baby, just sucking on those. Making sure for iron is not going to be brought through the breast milk as well for babies. So after 4 months, depending on when you start introducing solids, you want to make sure that they're getting enough iron. They usually have for the first 3 or 4 months. If mom had a good amount of iron in her body during the pregnancy, they're going to have enough for the first 3 or 4 months, but adding after that. Adding DHA if mom's not taking it. Vegetarian moms, once again, making sure they're getting enough B vitamins, calcium, iron, and protein. If there's a C-section, which sometimes happens for medical reasons, breastfeeding is going to help populate the gut with good bacteria. There's some debate at what point, but consider even using probiotics. If mom has a C-section, the baby's not getting exposed to as many of mom's good bacteria to populate their gut. So doing some probiotics early on can potentially be beneficial. Talk to your pediatrician about that, just to what's a good one, what's a bad one, when to do that. Now, the other thing you may hear, organic baby food. When your baby does start eating, 4 to 6 months, depending on when you start, should you do organic baby food? Is it worth it? There's a lot of debate on how much pesticides are in those. There's good studies on both sides. For us and our family, we tend to avoid those if all possible, either making it from fruits and vegetables that we're aware of, so that way you know exactly what's in there, versus buying in a store, making sure that it doesn't have BPA lining a can or the lid for the baby jars. So there's some good, if anybody wants those, just looking at the Facebook, or I can send you an email with some different sources that kind of show both sides, so you can see. I realize it's a cost issue, that organic is a little more expensive, sometimes a lot more expensive, and that way you can kind of look at the evidence and decide what would be the better of the two. And then after infancy, we look through childhood. Once again, avoiding the processed foods, which are stimulatory. A lot of children, now, not all children are super sensitive, but some children are going to be very sensitive to processed dyes, processed food colorings, preservatives, flavors, and you may find that when they're avoiding those things, their behavior is better. Whereas when they're eating those things, they're much more irritable, have more trouble sleeping, and can definitely, some kids are, like I said, much more sensitive to others. Sugars. One of the articles I had back there on the table was just about sugars. Once again, some kids are going to be more sensitive to others, but a lot of pediatricians will say, oh, the sugars don't make any difference. I don't know about their kids, but my kids, I definitely see a difference when I talk to parents and I tell them to cut sugar, or at least lower it down, avoiding some high sugar foods. Almost always, the parents come back, yeah, I really noticed that the kid obeyed a little bit better, less irritable, less hyper, could focus a little better. So even if it's not night and day difference, it definitely makes some difference. Now, rice products, one of the other things I forgot to mention, when you're starting feeding a baby, one of the things, rice has a risk of having arsenic. So arsenic usually doesn't sound like a good thing that you want on your plate. Even the American Academy of Pediatrics has recommended that parents limit the number of rice products their children get per week. And there's on the website, they talk about exactly how much. Even though the makers of the rice cereals say, oh, we're safe, we've got low levels. In testing, there is still some concern. Not necessarily that you should never eat rice or feed rice to your child, but more than a couple of times a week might be getting a little too much arsenic. And also there's some websites out there talk about how to prepare your baby's food or your children's food, about how long you can put things in the fridge, what should you put in the fridge, what should you not, what should you just throw away when you're done. Once again, looking through the remove things, anything that you shouldn't have started in the first place. If you've already been feeding your kid, looking at those things and saying, let's try to develop a new lifestyle, new habits, but don't get frustrated. Don't feel guilty because you learned something. No, I wish I hadn't started this in the first place. Just move towards a lifetime of health. And then as they grow, adding the age-appropriate foods, other good sources, helping them have a good balanced. One of the things, what I'd call a definition of a fad diet is one that your neighbor tells you, oh, this is great, it works for me, or you see somebody on TV or the website says, oh, this is great, everybody in the world should do it. So I'm not saying gluten-free is a fad diet. For some people it's great, but a fad diet is when you do something to yourself or your family just because somebody else said it was a great idea. And sometimes those are people selling things, sometimes those are people that your neighbors mean very well, but making sure you think through that before you jump onto a fad diet. One of the other things we really try to encourage families to do, adding in eating as a family together. Sometimes that's easier said than done, but They're going to learn habits from us as we're eating good foods. They're going to see that, and they're going to grow up remembering, oh, mom and dad eat these fruits and vegetables. They're still going to have, occasionally those things will be no's and thrown back at us, but it's going to be much easier if they see us have good habits and is sitting down together for that. And then moving on a little bit to through the teenage years, again, avoiding the unhealthy fats. Trans fats. That's one of the things about the processed foods is it's where you're going to find most of your trans fats, which is probably one of the reasons why we're seeing such an increase in diabetes, heart disease, having a negative effect on our health. Again, high sugars, avoiding the high fructose corn syrup, which if you've looked at all, it's got probably 50 different names. It's more aliases than the terrorist groups we have. You know, like, how many names can they come up with for something that's bad? Can we just make it simple? High fructose corn syrup. Everybody knows what they're looking for. I mean, we don't put, you know, on one road have a stop sign that's green, another one that's purple, then another one that's orange, another one that's, you know, polka dotted. We put all the stop signs one color so everybody knows. Stop. High fructose corn syrup, stop. But people are trying to sell their products, and hopefully we'll get rid of trans fats before too much longer. Again, removing things, if you've done a good job getting them up through teenage. If you're just starting to get into healthy, our family kind of grew into eating more healthy, and we've had to remove some things from our kids' diets when we realized, oh, that probably wasn't a good idea. Don't feel guilty. We just do the best we can. As you learn, you keep doing better, and your kids, hopefully when they grow up and they're having kids, will start much further along than we did. Adding teenage, make sure one of the things you're going to need to do for your teenage years when you have a teenager in your home is add money to your grocery bill. They will be eating more. Partly of that because they need more protein. They're growing a little faster, that growth spurt. Making sure they have sufficient cholesterol. Doing a low cholesterol diet for teenager. Cholesterol is used to make your steroid hormones. Testosterone, estrogen. For boys and girls going through puberty, they need enough cholesterol so that they can make the hormones that's sending them through that development. So that would not be a good time to do a really low cholesterol diet unless you had a familial, they were born with some genetic problem where they needed to keep that to a limit, but you want to make sure they're getting enough so they can make those hormones. Again, a balanced diet, making sure they're getting about a gram of fiber for every 2 pounds of their weight. Fiber, for boys and girls, different amounts of fiber, but getting some fiber in their diet helps the gut bacteria to be healthy, helps their just weight control, lowering inflammation, keeping a lot of things in line. What is the point of all the things we've talked about providing good nutrition? It's loving God by caring for the blessings He's given us. And it's loving our closest neighbor, our children, by raising them and sending them to the world with a healthy lifestyle.